their parents' plan going forward, and if there is any availability within the district to bring these children and young people back. We link very closely with fostering, with our own in-house foster carers, to understand if there's any vacancies, and whether we could, if appropriate for that child or young person, to bring them back into the district. And we work very closely with other partners in terms of progressing permanency plans. But by progressing those plans, that means that those children that are in adoptive placements or who are with kinship carers, we can finalise those plans. Therefore, they don't need to be open to social care anymore, because the placement that they're in has been deemed right for them, and we can then withdraw and exit from that. We are also focusing really heavily, I think I touched on it earlier, in terms of our recruitment of foster carers. We are and it's one of the items coming up. We are looking at further developing the Mockingbird project. We've already got one constellation, and we want to further build on that and develop more constellations, which would mean new carers, which would mean availability to place our children and young people again locally within the district. That's it from me. Happy to take any questions, and I can see Councillor Lum has raised a couple.
Yes, thanks, Cheryl. So Joy Lum is asking, what support do children outside the district get in terms of things like access to emotional wellbeing support, and also kinship carers are often unprepared for dealing with traumatised children. How do we support out of area kinship carers?
Yeah, two really good questions, actually. Thanks, Chair. What I would say is that we would never, or it would never be intentional to leave any child or carer without any support that they required, regardless of where they were living. If we couldn't, if they weren't local to us to be able to, for us to provide that, then we would certainly engage with their local the authority, the local authority that they were residing in, to try and understand what would be available. And we would also work very closely with our health colleagues in CAMS with regards to accessing the most appropriate service, whether that be from CAMS, or whether that's something that we as a team to commission together, in terms of the needs are such that we need to commission some professional to come in to do an assessment, an intervention plan with that child and young person. And in terms of kinship carers, if they're kinship carers, they're our carers, so we support them. They will have the training. They need to undertake training as kinship carers. That's no different to being a mainstream carer. They have to go through the same training opportunity, given the same training opportunities as everybody else. They will have the fostering support social worker that will support them, and again make available to them any training and resources that they would need to help them understand the needs of that particular child placed with them and how to respond to that. And also, again, linking in, we have a placement support offer which is linked very closely with the emotional wellbeing team, and the placement support worker will work very closely with, again, foster carers, kinship carers included, to do some work with them to develop their understanding and support them being able to maintain those placements.
Okay, thank you, Cheryl. Is that okay for you, Joy? And does anybody else have any further questions for Cheryl?
Yeah, that answers my question. Thank you, Cheryl. I was just wondering about the practicalities of it, because I'm guessing that some of these children will be quite a distance away. So actually the practicalities of having them attend training that might be in Wakefield when they're living elsewhere, I guess you would probably do it online, would you, or something like that?
Yeah, we're doing it online at the moment because, as you know, everything's gone online because of the pandemic. And that's for all our foster carers, whether they're local to in the district or whether they're placed in Barnsley or in Leeds, whatever they are. It's all virtual at the moment.
Okay, thank you.
All right, thank you.
Okay, thank you, Cheryl. There's no other questions come through on the chat box, so we'll move on to item 8, which is the children missing from care report, and I believe Craig is here to give us that report.
I am, thank you. Hi everyone, I'm Craig Liversage. I'm service manager. One of my responsibilities is for the children vulnerable to exploitation and missing service. So I understand everybody's had sight of the report, so I'm not going to go through it in detail. I'll just summarise this if that's okay, and of course I'll be happy to answer any questions people may have at the end. So in summary, between April last year and March this year, we've had 42 young children in our care go missing, and that equates for 180 missing episodes altogether, which obviously means that for some young people they go missing on multiple occasions. Out of those young people, 21 were placed in Wakefield area and 21 outside Wakefield area. I just want to talk about a little bit about what we do. So every day we have a joint meeting with the police where we review any young people that may be missing overnight. Social workers attend that meeting, and we discuss what action is required and how we intervene and what steps we need to do to locate and find individuals. When they are found, we do a face-to-face return home interview, and we've continued to do that throughout the pandemic. The purpose of that is to not only to ascertain if the young person is okay or if they've come to any harm, but understand why they went missing, what steps we can take to prevent further missing episodes, offer any support that may or may not be required. But it's also about forming positive relationships. So if a young person doesn't want to see us return home, we will continue to visit or continue to keep in contact, so that if they do have a future missing episode, we're a familiar face, and we hope that through building that relationship, we're able to see a reduction in how we in the missing episodes. We also support placements. We will talk to foster carers, offer resource packs. We have links to our local children's homes where we work alongside the staff there in order to help reduce missing episodes. We contribute and we support practitioners in the formulation of family plans known as the Philomena Protocol in Wakefield. So there's a lot of activity that goes on between ourselves and the police in terms of not only trying to find people when they're missing, helping to understand the reasons why and prevent further missing episodes. So when we talk about impact, I think it's important to look at our numbers alongside our statistical neighbours and other local authorities. So for 1920, so this year's data hasn't been, we've just into April and we haven't got the final year's data yet, but for 1920, Wakefield saw 6% of its children in care population had a missing episode, and that sits alongside 11% our statistical neighbours, and actually nationally 11.5%. So actually the work that we're doing in Wakefield is very positive, and we can see that we have very low numbers of missing episodes when considered to other parts of the country. And we think that that's really around the relationships that we build not only with the young people but also the professional network and the carers in terms of reducing missing episodes. So I mean, yeah, I'm sorry, I'm pausing because I saw a question come up. I'll come back to that in a minute if that's okay, Councillor Spate. So yeah, we we think it's a very positive story. Our numbers are low in compared to our statistical neighbours, and that's certainly from a national peak. And very few of our young people go missing for long periods of time. And I'll answer that question. There's lots of different reasons why children go missing. It can be because they wanted to go off with their friends, they come back late. It could be that that they're having an overnight stay. There are lots and lots of different reasons. There, as you would expect with children, there is no one reason, and it's very much down to the individual and their circumstances at home at that time. So, very brief presentation, but if anyone wants to ask me any questions, I'll do my best to answer.
Thanks, Craig. Just a couple from me. At what stage are children classed as missing? Because as you say, they don't always regard themselves as missing. They've just gone out to see friends. So at what stage would that become a missing episode? Well, and also, what's the age of the children going missing? I'm presuming they're teenagers. Do we ever have children, say 12 and below going missing?
I don't have the ages to hand. Again, it's something that I can ask our performance PBI, as we call them, to break that down. You're right. The majority of young people that go missing are of older young people, but I can definitely provide that information if you require. Sorry, what was the first question in answering?
At what point are they classed as missing?
Oh, that's very much down to the individual child and their circumstances, and we work alongside the carer to agree when a young person should be reported missing. The process is that if a carer is worried about a child, that they'll phone our emergency duty team, and they'll phone and the police, and the police make that decision whether or not that person is absent or missing, and that's dependent on the circumstances around their missing episode. So from that starts the process that we're describing.
Yeah, okay, thank you. So we have a question from Joy Lum. Is there any way of identifying potential absconders before they go? I'm thinking maybe the child's social worker or other adult ought to have that strength of relationship with the child.
Prevention is always better than cure, of course, and the missing service, that starts once the child is missing, and we hope that the work that we do prevents further missing episodes. Of course, with the social worker and their relationship that they have with the young person is pivotal in terms of keeping a child safe and promoting positive outcomes. And we would anticipate that as part of the work that the social worker is doing, they're gauging about whether or not there may be a risk of somebody going missing or putting themselves at risk. And of course, we are there to offer advice and support to social workers, carers, if required, that's felt before they go missing.
Okay, thank you. Does anybody else have any other questions?
Can I just, before I close, in terms of our Find Me plans, the Philomena protocols, that's a document that's compiled alongside the young person, and it talks about what somebody's triggers may be for going missing. So when this happens, I'm more likely to go missing. So that and when I go missing, I go there. So it's really it's a plan really, so that we know where to try and find somebody or know what somebody's triggers are for when they go missing. So I just wanted to add that. Sorry, I didn't need to talk about that.
Okay, thanks. And Kath Scott has a question.
Yeah, does this include the children who are just missing for 10 or 15 minutes? If they're with a foster carer and they're late coming home, and so the foster carer has to ring it in to say that they're missing. Does these numbers include those children?
It can do. If the foster carer has reported them missing, we've worked really hard to reduce those type of missing episodes, because those of us that have had children and they come home late, we don't necessarily always pick up the phone and report them missing to the police. So we work really hard with carers, and a lot of our work is around, actually, this is what the steps that we need to take before we report them missing. So I can't say if it's definitely not, but we've worked really hard to try and reduce those type of missing reports.
Can I come back on that? So how long is the foster carer supposed to wait before they actually register a child as missing?
There's no set time, so there is no time. It's set with it. Firstly, it's alongside the social worker. So the social worker might say, if a child's never gone missing before and they've always turned up dead on time wherever they may be, it may well be appropriate for that foster carer after 10, 15, 20 minutes to phone them up, the police. There is no set time. Very much dependent on the individual child, and the plan that's set in is agreed with the social worker, and if we're involved, the missing team in the final plan.
Right. Okay. Thank you very much. Thank you.
Thanks, Craig. I think it would be interesting to see at a future meeting, breakdown of age and maybe, children who are having repeated missing episodes or ones that are just one-off. So if we could bear that in mind for a future meeting, I think that would be useful.
I can provide the average number of days. I can absolutely do that. Well, I can ask for somebody else to do that, and a breakdown in age group, and I'm more than happy to provide that information.
Brilliant. Thank you. Thanks very much.
Okay. Thanks, everybody. Bye.
Thank you, Craig. Bye-bye. Okay, so we'll move on to item 9, which is an update on the Mockingbird project, and I believe Krista Hardy is here to report that.
Thank you, Chair. Good afternoon, councillors, ladies and gentlemen. I'm Krista Hardy. I'm advanced practitioner in the Mockingbird team, and I'm driving the project forward from fostering team. So I hope that you have received the previous presentation that was done for the cabinet members to give some background information, and then also the report for the committee meeting. As Craig said earlier, I'm not also going to go through the whole of the report, so I'm just going to go the main points of that, and if you have any questions, please do ask. So our first Mockingbird constellation was launched on 18th of January, and it's a constellation that consists of the Hub home carer and 6 satellite families around that, and there are 13 children that are looked after within the constellation, and also 1 young person who's staying put. The first constellation has been able to provide foster family and 1 young person also for family who's returned from an IFA from out of area, and also from a residential out of area. So in terms of the whole of the project, how it's been running, and the aim of it is to provide support for foster carers on a daily basis, so that they have access to ongoing support also out of hours, and peer support and practical support from the Hub carer. It has gone off to a really, really good start. Even we had to launch in the lockdown and do this virtually. We haven't been able to provide the sleepovers as planned during this period because of the lockdown restrictions. So the Hub Home has been providing help for the satellite carers in terms of on emergency basis where there was a risk of placement breakdown, and when the need has been greater than the risk. What we do in the Mockingbird constellation, we have once a month social meetings, and these have been virtual, where all the children, young people and the adults get together, and we do different activities aimed for the ages of the children, and this can vary because obviously the ages of children that we have are from 4 to 15 in the first constellation. So we've done anything from Easter egg hunt to baking cupcakes and things like that. And our first kind of face-to-face meeting is planned to take place end of April, which is a meeting in the park. So we will be just doing casual walks in the park and having a meeting that way. And in terms of the support for the foster carers during this period, we've also done virtual coffee mornings once a fortnight, where the foster carers have been able to come and have a chat without the children being present. like I said about the sleepovers, the aim is to provide between 10 and 15 sleepovers over the years, over the year period. And the children and young people are very much involved in deciding when they want to come to the hub home. They all got their own little diaries where they can put the times and request when they can come for a sleepover at the hub home. One of the young people was also selected for the Mockingbird Nest nationally to take part for a group that meets up once a month with different constellation and children and young people across the country, and this has been very well received as well. One of the other benefits that we have had from the Mockingbird is that there is an increased training of foster carers, and our aim is to get therapeutic parenting very much embedded in the fostering practice this way. So, for example, end of January, half of the constellation carers attended secure-based training together, and they said it was a really good bonding experience also between them, but has also helped in terms of practice that they have been able to have the discussions about what they've learned on the training afterwards in the coffee mornings and chats. We've also had another satellite carer joining during the training because they were in a situation where things were quite stressful during the lockdown, and the carer had actually given notice on the placement, but as a result of having discussions with us, they've joined Mockingbird and now have agreed to have the young person for as long as needed. In terms of future plans, what we have for Mockingbird, obviously we are very much wanting to develop the therapeutic fostering, and this way ensure that young people have more settled placements and less placement breakdowns. And the plan is to shortly commence therapeutic parenting training, which will take between 6 to 8 weeks with all the carers that are in the constellation. And also launched the second constellation coming July, August this year, and we are in the long term looking at launching constellations across all the wards in Wakefield, so that there would be constellation in each of the areas within Wakefield district. In terms of the feedback and things that we have been getting from the foster carers so far has been really, really positive, as well as from the children and young people. There's been comments like it's like one big extended family already. Also, there's been comments about how the children, the fact that we have been in lockdown kind of has helped, because now that we are planning to start more face-to-face meetings, that they've been able to talk to each other and see each other virtually. They've been getting to know each other slowly, so it's kind of been breaking those barriers. And children are feeling very much that it's much easier for them because they're able to speak to other children and young people that are in exactly the same position than they are. So they don't have to explain about why they're having pet meetings at schools or review meetings, because they know that everybody else in the group is in the same situation than them. And in terms of the overall kind of aim of Mockingbird is obviously to provide placement stability and increase the rate of foster care recruitment, because obviously good words travel fast. And we're also hoping that we can increase children returning, like Cheryl said earlier, from out of area placement and residential placements, because the carers will have more support and therapeutic training to support the children and young people that they're caring for. That's in a nutshell from me. Please ask any questions.
Okay, thank you for that, Krista. I've got a question from Joy.
Hi there. Well, I've got loads of questions actually, but my first one is what have been the major challenges of setting it up? Because it's certainly new for the hub carer, isn't it?
Yes, that is obviously the hub carer kind of recruitment has been challenging, because we need to have people that are experienced foster carers or experienced in caring in other ways, and usually if we have any experienced foster carers, they are full to capacity, and there is no space because we need to have one spare bedroom in the hub home and another space for emergency sleepovers. So that has been a little bit tricky, and still proves to be tricky issue going forward, but I'm sure that we will manage to overcome that somehow, in terms of going forward, getting more hub carers as well to join.
It would be nice to hear once, because it feels to me, and you can correct me if I'm wrong, that it's kind of partially running because you're not able to have regular planned sleepovers, and presumably you're not able to do contact, because am I right in thinking the hub carer is supposed to host contacts?
Contact with, do you mean siblings or?
Yeah, it says in your slides, it talks about hosting birth family visits.
Yeah, that is the plan going forward, and they haven't been able to do that. But what they have been able to do, they have been able to take part for some of the contacts, for examples where the siblings are in a different placement, as well as the foster child who's within Mockingbird. Right. So which have been taking place in parks and places like that at the moment. So
it'd be nice to hear again, kind of when lockdown eases, how it's going once everything's happening and the hub home can function fully, I think.
Yeah, I'm quite happy to come and speak to you about that once we get going with all the things that we've planned.
Okay, thank you.
Thanks, Joy. And we've got a question from Celia.
Hello, thanks, Krista, for the presentation. It may be going over some of the ground I think that Joy's already covered, but I'm just wondering if you could explain a little bit more about the purpose behind the overnight stays. And I mean, when I first read it, I thought, is that because you can have a few children together and it's a bit of a party atmosphere? I didn't quite know what was going on. And also, where do they take place, and what's the capacity for that?
Yeah, Thank you, Councillor. The sleepovers take place at the hub home, at the hub carers place. So one of the ideas is that if you've got sibling groups, like it was said before, that one of the siblings is part of the Mockingbird group, and then they might have other siblings that are in a different area, that they can actually come together in the hub home and have more like a natural kind of contact and stay overnight, obviously in separate rooms, rather than meet in a contact centre or out in the community if it's not appropriate necessarily, and that way kind of strengthen the sibling relationship. But the sleepovers with the hub home for those children that haven't got siblings is basically just to kind of also give a little bit of a break to the foster carers that they're with, but also give an opportunity for the children to come and spend more time at the hub home, have an overnight stay, sleepover, and that's why we call them sleepovers and not respite care, because it's fun, something that they want to do.
Thanks very much. That sounds really good. Great development. Thank you.
Thank you.
Thanks, Celia. Thanks, Krista. If nobody has any other questions, thank you again for that report. And yes, and we look forward to further reports as the project develops. It sounds really good, really beneficial. So thank you for that. That is the last item on the agenda in terms of the public part of the meeting. So could I ask that the live stream is now turned